Welcome to our first Education for Global Peace webinar. Help and stop the domestic violence now. We want to welcome our panelists, Alessandra Pounce, Nicholas Bastidas, Silvia Vukovic, joined by her associate Ivana Kevich, who will introduce themselves in a minute. But before we get into the discussion, I want to say a few brief words about Education for Global Peace. EGP exists to bring peace building and peace education resources into the world so that our communities, our cultures, our societies, and our interpersonal relationships in our states are more nonviolent and peaceful and just. And we make those resources available to the world for those reasons. We are engaged in a set of exciting projects right now, from building a global peace education index to creating the world's most useful database for peace education resources, building with partners a global coalition and movement of peace educators and peace builders, and providing resources such as this webinar and webinars that will follow in the months and years to come. Indeed, in July, our next webinar will be about opportunities for peace building and peace education that have been opened up in the response to the police brutality and the murder of George Floyd in Minneapolis, Minnesota, USA, and the worldwide protest against that kind of brutality leads us to ask questions about what kind of police reform can we now push, what kind of racial justice must we pursue, and questions of that kind will be discussed in July at our webinar. And in August, our webinar will focus on the way that youth around the world are providing leadership and innovation, from engaging the climate crisis to resisting gendered violence to pushing for more democratic processes. And so we'll raise questions about how we can support our youth and learn from our youth in this exciting time. For more information about Education for Global Peace, about our projects, what we do, how you can get involved, and the upcoming webinars, please visit us at our website. Thank you for now for being a part of this conversation, which is going to begin momentarily and about which we're very excited. And as we will wonder about what to do about domestic violence as it has been growing under this COVID-19 pandemic. But before we do that, the moderators want to briefly introduce themselves, and I'm one of those moderators, so I'll do that first. My name is Michael Minch. I am the founder of the Peace and Justice Studies program at Utah Valley University in the United States, and directed that program for 13 years. In addition to teaching peace and conflict studies, I also teach political philosophy and ethics. And I have taught and conducted research and have done peace building work around the world in various places, including Haiti and Northern Ireland, Russia, Central Asia, and West Africa. I'm currently writing a book which is a very ambitious and comprehensive argument that the only necessary means we have to building a global world of resilient and sustainable peace is through radical democracy. And I have been on the board of directors of EGP since its inception. So that's a little bit about me. And now it's really a pleasure to turn it over to Maria Paula, who it's a joy to work with Maria Paula. So here it is, over to you.
Thank you, Michael. So my name is Maria Paula Unigarro. I am a political scientist. I've been member of EGP since February last year. and I've been working on the peace building field for about 6 years now. I've mostly worked on the Colombian armed conflict. I've studied specifically reconciliation processes in the country. And besides that, another issue I've worked on and studied is gender-based violence. I've done so in Colombia and Bolivia. And this year, with EGP, as we saw the increasing rates of domestic violence being reported around the world during the first weeks of confinement due to the COVID-19 pandemic, we decided to launch this project, which is Help Stop Domestic Violence. The idea was to publish weekly resources on how to prevent violence and manage conflict at home, considering the circumstances. And this webinar is part of this effort. So we basically want this to be a space in which we can reflect on what we have seen this year in terms of domestic violence, of course, but also think about possibilities of what can be done to stop this problem to continue growing around the world. And so I thank you all for accepting our invitation to participate in this conversation. And I kindly ask you now to please introduce yourselves. Perhaps we can start with Silvia and Ivana.
Okay. Hello, my name is Silvia Vukovic. I'm psychologist in a home for victims of domestic violence in Zagreb in Croatia. I've been working here for 6 years, and this is my colleague.
Hi, I'm Ivana Kresic. At a shelter for victims of domestic violence. I'm quite new to this field. We haven't been working in this field ever before, and here I'm only for.
Thank you, Silvia and Ivana. Nicolas.
Thank you very much. Thank you for the invitation. I'm Nicolas Petsidis. I represent the Union of Women Association of Heraklion. In Crete, Greece, the Union of Women Association is a women NGO very active on domestic violence and gender issues. The union is one of the biggest organizations in Crete and one significant player at national level at the elements of gender-based violence and gender equality. Our organization is a member of WWP and WAVE, European networks combating gender-based violence. And our organization was quite active during the days of confinement. I am project manager and project coordinator of the organization, meaning that I am responsible on coordinating all the small and big scale projects of the organization. I am on board with the organization since 2012. Thank you.
Thank you. And Alessandra?
My name is Alessandra Pounds. I am the Executive Director of the European Network of the Work with Perpetrators, which is WWP. It's a network organization throughout Europe that has more than 60 members from different European countries, representing both perpetrator programs and women's support services. I've been in the field of domestic violence for the past 25 years. I worked for 15 years in a women's center and in a shelter, and then I founded in Italy the first perpetrator program, and I'm currently also involved in the running of that project and in the national work network in Italy.
Thank you, Alessandra, and thank you all. I'm sure we'll have a fruitful conversation considering your knowledge and experience. And now, Michael, could you please tell us how we're going to proceed?
Yes, I just want to mention that Maria Paula and I will both ask questions of you, and we may address that to one of you in particular, but probably more often address it to all of you. But we also want to invite you to engage with one another and ask one another questions and follow up with one another. And so our conversation for this next 45 minutes or so is going to be meant to be a real conversation. And so I want to ask the first question, and I'd like you all to feel free to respond, but I'd like to address it to Nicholas first. And it's a very basic question that you all probably knew would be coming. And that is, can you please tell us about the rise in domestic violence globally during this pandemic, but not only just give us, statistics about the rise in the incidences of it, but can you speak to us about what kind of triggers or what kind of specific elements of this domestic violence that may be present and what may cause the spike in domestic violence under these conditions, and what kind of particular features may be a part of this this phase of domestic violence that we are seeing around the world. And again, maybe you could begin for us, Nicholas.
Thank you very much, Michael. Actually, I would mainly talk about Europe and my country. We haven't yet any clear clear outcome of what happened during the pandemic and the lockdown. For sure, we have seen a rise on incidents of domestic violence. For sure, our hotline, and in Europe, we have seen increase of incidents of domestic violence, of calls on hotlines. Our call center has followed the same, let's say, trend in Europe, which is a steep rise on the first weeks of the pandemic and the lockdown, followed by a fall at a level which is significantly higher than the same level last year, the same period. What I would say is that this lockdown was a very stressful situation, and escalated the tension within family. We have seen desperate calls, fragmented calls. We have communicated with other organizations in Italy or in Cyprus or in Austria. And we have seen a similar, I would say, trend, like people, women calling, and mainly in times of crisis, not afterwards, and trying to find a solution on what was going on at home. We have seen that the calls were fragmented, were shut down, because it was the moments of crisis. So the main mission was to try to provide support at this time of the call. Right now, after the lockdown, we have seen and we have worked out follow-ups, and we could follow up only the 10% of the calls that we have received. So I would say that it was a stressful situation for all the players, I would say, the supporting organization, the public sector, the families, the women. So our mission, and I feel the main mission of many supporting organizations or hotlines, was to provide support and to provide solutions on the problems that were discussed. We tried to, as an organization, to bring pieces together, meaning that to mobilize police or to try to provide assistance to the woman on how to communicate with the police, because in many cases police was not responding, However, at some other cases, we had to mobilize police ourselves to respond to incidents and calls, or the local judicial system that increased the courts were closed and were active only on severe crime incidents. So we had to mobilize like the players, and people were afraid to go to the hospitals to ask for assistance because of COVID-19 transmission. So we had to to bring pieces together and try to organize a solution. In sum up, it was a fragmented request for help. There was a tight control from the perpetrator, meaning that she was not able to call again, or she was not able to step out and relax a little bit. It was a crisis moment that we had the calls, and there was a lack of communication that we didn't have a follow-up call on that. So our mission was to provide support at this time, sometimes at 4 o'clock in the morning, for example, or to help somebody who was outside of Crete, somewhere else in Greece. So we had to organize a mobilization scheme there, like to call the police and communicate the incident. So I would like to end my first talk on that, saying that it was a stressful time for all of us, actually, for people who were at home and they were afraid of, and we were working from home. We were not working from the office, and we had to respond from mobile phones converted, and we tried to be creative on the way that we would provide the maximum support to the one that was calling, and we knew that she might not call again because of the tension, because of the pressure, because of the control of the perpetrator.
Thank you so much. Alessandra or Sylvia?
I'm so sorry. We in Croatia also didn't notice a difference in numbers or dynamics of domestic violence. Perhaps it will show later after all that COVID-19 epidemic. I don't know.
You also must know that Zagreb faced quite a strong earthquake in the beginning of the lockdown. Like in some bad movie, we faced actually 2 catastrophes. So it's maybe possible that people homogenized against, so to speak, external enemy, and they focused less on their internal relationships. And even 3 months after the earthquake, we are facing almost constant aftershocks, almost on the daily basis. So I think it is something that makes our situation, at least for our area, because we are situated in Zagreb, in capital, it is maybe something that changes our situation. So uncertainty was higher maybe than in some other places, because, and maybe some victims felt that they need to postpone solving one problem until they solve problem maybe they had with their houses, because many houses were labeled red to say because they were not suitable for living anymore. So problems that we're facing are a little bit different than in other places.
It's a question. The question was sort of on some of the triggers and the elements that created an at-risk situation. So we have, we still don't have comprehensive data on what happened during the pandemic, as Nicholas was saying. We do have some data, but you said at the beginning of your question that you didn't want that. So if you do want me to go over some of the data that we do have, you can have a follow-up question. But let me try and address the issue that you did mention, which was the sort of the triggers. So all of us that were involved in the domestic violence field were immediately very concerned when we when the lockdown started, because we knew that there were certain factors that represented risk factors in situations of domestic violence. So we had the forced cohabitation, we had increased family caring loads, the schools were closed, so there was the extra having to take care of the children, and actually we did some outreach work with the victims, the perpetrators in the programs, asking what the major situation was, and they in many cases, the psychological violence had increased, but the physical violence was actually not so severe. But the major issues of concern were around childcare and issues that arose from the fact that there were all the homework to do and following the kids in all the activities, and that created a lot of tension. There's obviously a linked economical crisis. Many people were losing their jobs, and this we know is another risk factor for situations of domestic violence. The sense of uncertainty, we didn't know how long it was going to last and if things would or are going to go back to normal. And so a lot of fear and anxiety for the future, which in some cases actually may have been an external enemy that created some kind of regrouping of couples. Also, the fact that most partners were in lockdown, I mean, very often provided for a situation that was very controllable for the perpetrator, so it was actually quite favorable for his need of controlling his partner, and which might also account for the fact that the physical violence wasn't severe. However, we knew and we know that there's this very, very critical situation that we're all monitoring with great apprehension.
Thank you.
Thank you.
And sorry. So I actually wanted to ask you a follow-up question on this, because you all mentioned that homes started experiencing increased tensions due to all the external factors that were going on. So my question is, these cases of domestic violence that you attended or knew of, were new cases, or is this like families who had already experienced domestic violence, or families that had never experienced that, but due to the situation they were now facing domestic violence?
Should I start? Or?
Whoever wants to start. So if you want to do it, Nicolas.
Well, I would say, and this is a big discussion started among the women organization, is that we would argue that domestic violence, we had like the lockdown was the trigger of incidents of partner violence. The situation might be existed. The tension must be there, must have been there, and the spread, the tension of the lockdown, the uncertainty, and all this emergency situation, the unpredictable situation that happened to all of us, escalated the tension and inflicted like incidents of violence. We wouldn't claim clearly that confinement was a direct contributor for violence, even for couples who didn't experience violence, for example. I think that we think that it was a factor that escalated tension.
Can I add something? In my opinion, the causes of domestic violence are abuser believes that violence toward his partner, especially toward women, are acceptable and justified. And I don't think anyone can be abuser because of some trigger.
I think it's still early to sort of be able to really have an idea of what actually happened, because in many non-domestic violence related situations, there is also a very positive regrouping of individuals and families and couples. And also, again, since everything was strictly controlled over the period, sorry. Over this period, it's hard to know exactly what the outcomes are. However, I think I agree with the colleagues that tendentially we were more involved with perpetrators that were already in the programs. However, there was also an increase of help requests to certain helplines. Respect, that is an organization in the UK, their request for help went up by 93%. So I think that there may have been some situations that were exacerbated by the lockdown.
Okay. Thank you. And also, in terms for the victim to look for help, Nicholas already mentioned that it was not easy and it did so like during the situation. But have you seen like any response, like now that like many months have passed, have you seen a better response from the authority?
I don't know if a lot of months have passed, because in many countries, the lockdown has just started. The process of everything opening up is just gradually going back to normal. And so I don't really know that and I mean, if we look at the European level, it's very different in different countries. Even the response of the community support in terms of all services was really different. For example, the UK had a massive response, and there were many programs and things that were set up specifically to respond to domestic violence, starting from housing programs that were alerted. And so there was a massive attention that was dedicated to that. In other countries, the governments were sort of ignoring the COVID, and so there was very little that was going on. Also in the UK, there were massive resources that were poured into domestic violence. Now, to my knowledge, there haven't been that many resources that have been poured into domestic violence by other countries. So it really varies very much from country to country, but I think that is also hard to say. And obviously, makes a huge difference, the social response and sort of the community response in terms of enabling victims to leave. Or also there was a whole strong movement of removing the perpetrator from the house. That was also, there was a lot of discussion around sort of trying to focus on this, but again, without a system in place, it was a little hard.
I feel that it's very essential to highlight the community response. And I hear some noise of my voice again. Okay, now it's okay. I feel that since mainly I would argue about Europe. Since the public sector was quite preoccupied and busy with all these measures and the COVID transmission, I feel that the catalyst was the community response and the dynamics that it created to sparkle like institutional actions by the public sector. We have seen that. We have discussed it with other organizations, and I feel that it was the element that like boosted the process, the social dialogue that it has been created, the activities and the campaigns at social media, on public speaking, radios. Like it mobilized the situation even more in favor. And what Alessandra said, the move that is of removing the perpetrator from the house. This was a very well discussed issue that I think that it started from Italy or was something that was. I think it was from Italy.
Yes.
And this was the outcome of the organizations who were active, and they tried to mobilize the system, let's say, to respond at a better way.
Okay. For sure, there was a lot of pressing from NGOs to secure responses. For example, also always in Italy. Italy was one of the first that went in lockdown. The women's NGOs pressed so that they had locations where women could go before going into the shelters because they had to quarantine them and they didn't have anything set up. And the government quite quickly decided to use voluntarily or forcibly the hotels that weren't being used to support women's centers in sort of in having spaces for women to be quarantined before they went into the shelters. So there again, that there was a response from governments that came from the NGOs pressing.
And this is also a lesson that we need to learn for the future. And we have an economic crisis ahead, and this is a message, a strong message, that funding of NGOs needs not to be minimized or cut. On contrary, it needs to be raised, because this was the reflexive of the society in times of crisis.
Thank you, Nicholas. And now that Alessandra mentioned the issue of the shelters, I know Silvia would like to add something about like the challenges that have been faced by shelters in organizing for attending victims during the quarantine.
Yes, thank you for the question. We had a rough time during the epidemic in our shelter. Nothing happened really, but we were all scared of infection, of problems. We had to find the best way to provide and accommodation and psychosocial support while at the same time protecting users and employees from infection. It was very hard. we had one of the first instructions of epidemiologists is to put new users, new victims in isolation for 14 days. Our shelter has space for that, but most shelters in Croatia doesn't. So it was rough time. On the other hand, I was afraid that survivors who just came to the safe house are in too much trauma or in crisis, and I was afraid how isolation may reflect on it. We tried to provide them as many as possible telephone counseling, individual counseling, but with masks and gloves and protecting equipment. It went pretty well, but we are exhausted.
In some cases, actually, victims even preferred to be left alone, but we still had to take a close look to monitor their behavior, to monitor their feelings, which wasn't easy from the position that we were in. But our experience, we cannot say it's over, but now we have some more experience with that, and we can say that it wasn't easy, but it was finally after coming from that isolation, I think they felt like they were taken care of and that they were getting support they needed. On the other hand, other shelters that don't have infrastructure and the logistics that we have, they were probably struggling, and even we would like to hear what their experience is, because we have separated units for each family, so they can stay isolated. We were just bringing food and supplies they needed, but in other shelters, it's probably not like that.
If I would say to our shelter, sorry.
No, go ahead, please, Nicholas.
We put emphasis in three elements: on safety, on communication with the women that were living at the shelter, and the continuous support that we could provide, even from telephone or messenger or chat or Skype or whatever. We were trying to be very creative on that, so not to feel that they left alone. Actually, we had to organize an entrance on the shelter from another city, and it was asked like within days, can you receive one survivor tomorrow? So we had to do that, and we had to take all the precautionary measures on not transmitting the COVID and quarantine her and her child, and then try to provide like a sort of safety, communication, and support at the same time, which was sometimes very exhausting to our staff because they couldn't go there, but they had to be on the line all the time or on internet, sending mails or chatting with them. So to feel that they have people there for them, but they are not there. Actually, they cannot go there.
Yeah, that's definitely a huge challenge, I believe.
I can tell you.
And now, on the side of the perpetrators, how has been working with them? Perhaps Alessandra can tell us a little bit about her experience.
So again, there have been sort of very different situations, but one of the first issues that the perpetrator programs faced when the lockdown started is that prior to this crisis, all online counseling and all work online has been seen with great suspicion in the field of perpetrator work, and there were many concerns. So the first concern was can this be done in a safe way? What are the consequences for victims? And to sort of try and weigh on the one hand what certain actions might have in terms of consequences for victims, but also what inaction, what kind of consequences for victim not doing anything would do. So is it safer to try and take the services online, or is it safer to just not do anything in this period of crisis? So that was a first very, very, very critical stumbling block. And we pooled, so the first thing was also to listen to victims to see what their take on it was. We pooled we called some of the victims that we had in our victim support services, and most of them were relieved to the idea that the perpetrator would still be followed somehow by the program. So they did not want the program to be interrupted. They felt that offered some kind of containment, and it offered an outlet for their partners and some form of accountability of their behavior. They also, I mentioned before, they gave feedback around increased tensions around childcare and in general house related and care related tasks. They reported increased psychological violence and decreased physical violence. So given this feedback that we had, we started to reflect on what would be the most safe intervention for perpetrators, and the European Network for the Work with Perpetrators provided almost immediately, within 10 days of a lockdown, guidelines for working with perpetrators. And the guidelines address specifically this situation. So even the risk assessment changed quite a bit. The normal forms of risk assessment, because obviously we were looking a lot also at were the partners living together or not, because in a situation of lockdown, if you're not living with your perpetrator, you're a lot safer because you can't get out of the house, which in other situations might have not been sort of a major concern. So it was about sort of revising this. Also, were the partners working or not? Because obviously if one of the partners or both the partners were working, because many people still continue working during the lockdown, that means they would be leaving the house for quite a few hours a day. So there were a lot of variables that had to be taken into account. Also, as we were saying before, it's really important for each country to assess what the social response was. It's useless to say call the police if the police aren't answering. It's useless to say go to the shelter if the shelter can't accept you to go in. So being aware of what was happening and what services were being offered, and also being proactive in finding solution, had to be also part of the response. So and on top of all this, at the time and currently as well, there are very different levels of lockdown. So there were a lot of programs that were still doing in-person work, and then there were countries that had started with a lockdown, others that were thinking about it, other ones that never went in lockdown. So there was a lot of variation. And for those that weren't in lockdown, that was one of the reasons for which we thought it was really important to get these guidelines out as soon as possible, because there was a lot of things that we were learning about what we needed to work with the perpetrators online that would have been really easy in normal conditions, but that became incredibly complicated once you're in lockdown. Even just getting a cell phone, you can't get out and buy a cell phone. You have to order it online. You have to order a special dedicated phone number. Most of our service providers did not have work-related phones to be able, and we also had to ensure the safety of our workers. They had to be able to, they were at home and they were working from home. Home had to continue to be a safe place. So how do you set that up? So there were just many challenges that were linked around this, but on the whole, we did think that providing some kind of support for perpetrators was important in containing the violence. The kind of support that we had to look at wasn't what we were usually doing in our perpetrator programs necessarily. and that it had to be more focused on overcoming the crisis, not so much focused on the violence at all times. So perpetrator programs were offering a variety of activities. They were offering relaxation. They were offering the possibility of texting and sort of being available to the perpetrators, and also trying to use it a little bit as a self-reflection around how they were feeling. So the service providers were very creative once they sort of got online with the goals of what they were trying to do, and also trying to adapt a lot of the techniques to a situation in which you were in lockdown. How do you take a time out if you can't go out of the house? And so there were just many challenges, but on the whole, our learning takeaway from this experience is that perpetrator programs can be a very central point of response, especially when access to victims is, for some reason, not possible, because you are directly and indirectly affecting and communicating with the victims, because you're also then talking with the partners of them. And so it was a way of not leaving them alone, and not so they were locked down, but there was somebody sort of present, monitoring, somebody that they could talk to, and somebody that wasn't. And it was sort of like having an open window at all times in the situation, and know how much having a sense of impunity or knowing that you're being watched can really change also the outcome of any situation.
Michael, do you want to say anything?
Yeah, I wanted to follow up, conscious of our time, and I'm learning a lot here. I appreciate this very much. Nicholas said that one of the lessons to be learned in this is, the role of NGOs is very important, and so we need to not cut their funding, but indeed increase it. And I want to ask all three of you if there are other lessons that we have learned or are learning from this that we need to apply to the problematic of domestic violence going forward. What other lessons do you think are to be found in this time? That's for anyone.
Can I start? Okay.
Sure.
One other thing is the use of new technology. The distance counseling, the way that we can use like Skype or chat or telephone or email to our counseling processes. We have realized as an organization that all the tools respond to different situations. So we would like to explore more on that and try to capitalize. And even more, if somebody is able to exhaust all these abilities and these benefits, then we can have a constant communication with the women or with engaged partners, and then to be able to communicate like key messages for assistance, like instant guidelines or some tips to maximize the support at this point of time. And I feel that this is we see an array of opportunities to improve our intervention and our supporting like processes that we follow. So one lesson is that, and one bad lesson is sometimes the weak response of communities. Sometimes we could see that people were isolated, they didn't care, and it was sometimes our task as NGOs or the public sector to mobilize communities, it's not only women, it's elder people, migrants, people with disabilities who could suffer from violence, and they were not able to even communicate and ask for help. So we feel that we should have done more for these like social groups, refugees.
Thank you. Sylvia or
Can
Ivana
I
or
say something? I think this whole epidemic story teaches how much, how important are information, relevant information about domestic violence, consequences of domestic violence, ways to report violence, about ways to get help. And I think this is a whole year job, regardless of epidemic or not.
Alessandra?
Yeah, I was pondering your question. I think we're in the process of learning. I think one of the things was what Nicholas was pointing out. How are we going to use these new technologies going forward? There is definitely a lot of hesitation in doing things online, but we have sort of discovered that certain things are possible. They may not be as good when that's not. And that there are potentials. I mean, we were actually, and I think that's what Nicholas was pointing out, we were in the houses. There were things going on while we were doing the sessions. And that actually offers an incredible window into what's happening, because one thing is men presenting their behavior. One thing is the men yelling at their child that comes in the room and interrupts the session. That it gives you direct access to certain things that are happening, and that's really interesting. I think that we are in the process. There's potentially a lot of change that can come, and a lot of innovation, and a lot of ideas around how to work in this field. It would require sort of some time and resources to actually be able to think these things through, because they obviously all have implications and consequences. So there's a lot of potential, but I don't quite know how that's going to develop in the future.
it would be interesting if, when possible, when the pandemic gets to a place where this is possible, to have a meeting of domestic violence specialists like you all meet in a international forum and learn and talk about this. How do we move in the future and explore these opportunities that innovation and technology give us, and how what we could learn from this, and how can we move forward, and what do we need to fund? And you're all pointing in that direction, sort of. I wonder if any of you know of plans for such a forum in the near future, or if you think that would be something that might be pulled together.
Unmuted.
Let me just take this occasion to say that we are organizing for the 30th of June a COVID-19 Work with Perpetrators mini conference. You find all the information on our website at WWPEN. I'm pretty sure there is going to be something like this. I'm not aware that anything has been set up. However, the interest and the link between domestic violence and COVID-19 is a very present and current thread. So I'm not aware of anything that has yet been set up, but I would imagine it will be. There are also, I mean, we've talked more of assets. There are a lot of critical aspects that have come up too with the use of technology within domestic violence field, namely stalkerware, all kinds of surveillance systems, also together with the more traditional forms of hate speech. And so, I mean, it's a complex area, and it's one that maybe offers potential to divert the kinds of answers we do, but it also poses a lot of risks.
Thank you for mentioning that. Yeah. Maria Paula, any final questions or comments as we bring this to a close?
Yeah, now that we're ending this conversation, I would just like to thank you all for your work. We now know that you faced huge challenges this year, and you've been like the organizations helping many people who were not receiving any help, any support, as domestic violence was triggered by COVID-19, but also hidden by it. So I just want to highlight your work, your efforts, and thank you once again for sharing your experience with us. We would like to spread your message and make this problem visible, but also make alternatives also visible.
Yeah,
Thank
thank
you.
you so
Thank
much
you very
for
much.
joining us. We
Thank you.
very much admire your important work, and with doctors and nurses and first responders and all healthcare professionals, you too are heroes of this time. So thank you, and thank you for making the time to be with us during this hour. We really appreciated it very much.
Thank you very much. Thank you for the
Thank you
invitation.
for the invitation, and
Thank
thank
you
you
for
for
the
taking
invitation.
forward this issue.
Okay, thanks so much.
Thank you.